Hello again. So this is your guest lecturer Abhilasha Vishwanath, and today we'll be continuing our lecture on Parkinson's disease, and we'll be talking about treatment options available for Parkinson's. So before we jump into the lecture, I want you guys to take a moment to come up with at least one way to treat the symptoms that you saw earlier about of Parkinson's. Um, and see what you think would be an effective treatment or what kinds of treatments you can come up with. And then we'll go through some of that in today's presentation. So for this presentation, we'll be looking at the different treatment options available for treating Parkinson's symptoms. And we'll be mainly focusing on levodopa or L-dopa treatment and its mechanism of action in the brain. We'll be going into some depth on that. And at the end, we'll also be discussing some limitations of this treatment. So for the treatment options available, your textbook goes or lists these three options. So the first is dopamine replacement therapies. So since there's a significant loss in the dopamine producing neurons in the brain, replacing some of that dopamine is one way to effectively relieve some of the symptoms seen in Parkinson's disease. The last two, the deep brain stimulation and transplantation technique, is just mentioned. We won't go through in detail into those. But deep brain stimulation is essentially a way to stimulate these deep regions in the brain that are affected in Parkinson's disease through an electrode that's implanted or that's put inside the brain of this patient, and it's controlled using a little pacemaker. So that is an effective treatment, but we won't be touching on that. And lastly, the transplantation of dopamine stem cells in the brain of a PD patient. It's still a work in progress, and there's not yet any success using that potential treatment option. It is something to note, might be coming up. But for this presentation, we'll be mainly focusing on dopamine replacement therapies. So dopamine replacement is one of the most common treatments methods used for treating PD patients, as directly changing levels of or increasing the levels of dopamine in the brain does effectively relieve some of the difficulties or symptoms that PD patients feel or experience. And we'll be going to levodopa, which is the most common dopamine replacement used currently, and it's a pretty effective medication. So we'll jump into what L-dopa is and how it does what it does. So levodopa or L-dopa is the precursor drug to dopamine. It is involved in producing the neurotransmitter dopamine. And an important thing to note here is the relationship between L-dopa and the blood-brain barrier. You have been talking about the blood-brain barrier before in your course. So dopamine itself cannot cross the blood-brain barrier into the brain or the central nervous system, but L-dopa can. The dopa is the amino acid that's able to cross the blood-brain barrier, and the levo, or L, uh, in short for L-DOPA, is the isomer that's most effective in treating Parkinson's patients so far. So together, levodopa does cross the blood-brain barrier and is able to directly increase or make up for the loss of dopamine in the brain by directly producing or increasing levels of dopamine. So I said that L-DOPA crosses the blood-brain barrier and increases the level of dopamine by producing dopamine. But how does it exactly do that? So here we're going to look at the mechanisms of action of L-DOPA. So first, it is taken as an oral medication, and this is important because while taking it as an oral medication, it first enters into the bloodstream. And so some of the breakdown or the production of dopamine happens in the plasma before it even reaches the brain. So only a small portion reaches the brain. Even though that small percentage of L-DOPA that reaches the brain does is enough to alleviate some of the symptoms in Parkinson's patients, but there are some side effects of dopamine or excessive dopamine produced in the body. So since L-DOPA is converted into dopamine in the blood or in the body, it leads to some side effects such as nausea. And it is not so useful for a treatment to have negative side effects. It may deter patients from taking the medication, coming off the medication. And it's not so useful if all of the L-DOPA is being turned into dopamine in the body rather than in the brain, as it will not ameliorate PD symptoms. So how can you make the drug more effective? How would you stop the breakdown of L-DOPA before it reaches the brain? For this, we have to look at the synthesis of dopamine itself to see what is required for the production of dopamine from L-DOPA, and that's coming up in the next slide. Here is an image taken from the textbook, and this shows the chain of synthesis of dopamine and what's required. So it starts off with tyrosine, and by adding a hydroxylase group, it turns into dopa, and then dopa decarboxylase, which is circled in red, is necessary for producing dopamine from dopa. And then dopamine is also a precursor for producing norepinephrine. But the focus here is that for producing dopamine from dopa, there's a catalyst requirement of the dopa decarboxylase. And this becomes important when thinking about how to stop the breakdown in the body before the L-DOPA reaches the brain. So something to think about is how would you do that, given this knowledge of the requirement of dopa decarboxylase. Yeah, how would you reduce the synthesis of dopamine in the body? So one of the ways to increase the effectiveness of L-DOPA is to inhibit the catalyst required for converting L-DOPA into dopamine, which is the dopa decarboxylase, which we saw in the synthesis of dopamine. So by inhibiting the decarboxylase in the body and not in the brain, reduces the breakdown of L-DOPA in the body before it reaches the brain. This alleviates the problem of the side effects seen with too much dopamine in the body. Another key thing to note here is the effort to keep L-DOPA active on its journey to the brain. And if the drug becomes inactive by the time it reaches the brain, then it's as good as not having it. So in summary, the L-DOPA requires this unique combination with another drug, which is a drug that could be inhibiting the dopa decarboxylase in the body in order for it to be effective in its action by the time it reaches the brain to convert into dopamine and increase the levels of dopamine in the brain. An example of such a combination is the carbidopa, levodopa, and entacapone combination medication. So you will cover the COMT enzyme and entacapone in the upcoming lectures, but the key takeaway here is that there is a need for a combination of another drug with L-DOPA in order to reduce the breakdown of L-DOPA in the body before it even reaches the brain. So we learned about how L-DOPA produces its effective actions in the brain to alleviate uh, Parkinson's symptoms. And it really works like a miracle as long as the patients are on the drug, as it restores the dopamine levels in the brain and almost miraculously reverses the symptoms that, especially the motor symptoms, that the Parkinson's patients experience. However, like with most drugs, L-DOPA uh, becomes less and less effective as time goes by, which leads to adjustments in dose and intervals that patients are given. So with time, there's a need for increasing the dose of L-DOPA administration and uh, reducing the time intervals in between the doses that the patients are being administered. With this, like within 5 years, the drug becomes really less effective. And these adjustments have their own side effects. And so this is one of the key limitations of this very effective drug, but with time it does deteriorate in its effectiveness. And we will look at some of the side effects that it has in the next slide. So we talked about how over time L-DOPA becomes less and less effective, and this leads to increasing the dose of the drug. But that has side effects of its own. So with increasing L-DOPA administration, patients are more likely to develop the dyskinesias, which are L-DOPA-induced motor movement disorders. And with dyskinesia, the features of dyskinesia are opposite of Parkinsonian symptoms. So for example, if Parkinson's patients have difficulty initiating movements um, and have slow movements, dyskinesia is where patients have really unnecessary and large movements and largely involuntary movements. And so this is like the other end of the spectrum, where Parkinson's is no movement at all versus dyskinesia is a lot of unnecessary movements. And so, and this is a striking number of patients develop dyskinesias, where within 5 years, almost 50% of PD patients develop L-DOPA-induced motor disorders. So this is one of the key limitations of L-DOPA, and it's important to know this and inform the patients about this so that they know the long-term effects of this miraculous drug that in its initial stages helps relieve most of the motor symptoms in PD versus it has the side effects of developing dyskinesia. So to summarize the main points that we discussed in the presentation today, L-DOPA is the most common dopamine replacement therapy. It is a precursor to dopamine. And under mechanisms of action, we discussed how L-DOPA crosses the blood-brain barrier while dopamine does not. And DOPA decarboxylase is required enzyme for converting L-DOPA into dopamine, and by inhibiting this enzyme, it helps to reduce the production of dopamine inside the body, which leads to some side effects. And so L-DOPA in combination with other drugs is more effective. Under limitations, we discussed how L-DOPA becomes less and less effective over time, which leads to increasing dosages. And that leads, or just prolonged exposure to L-DOPA drug leads to dyskinesia or L-DOPA-induced movement disorders. And that's all for this presentation. Thank you.